Dear ladies, dear gentlemen, dear organizers, thank you very much for giving me the opportunity to speak a little bit about fires and ketogenic diet. For everybody who doesn't know who I'm coming from, it's near the French border, only 5 kilometers far away from Strasbourg. And these are my disclosures. And so let's speak a little bit, what is fires? Fires has first been described by Andreas Bahlen, who is a German neuropediatrician from Kiel. And fires is a febrile infection-related epilepsy syndrome. And it happens in previously healthy children. And they prevent seizures with a very close temporal connection to an acute febrile illness, often after a short recovery. It has an explosive onset of severe seizures and going into a severe status epilepticus. And this status epilepticus is really absolutely therapy resistant, even to anesthetics. And encephalitis has to be excluded, and if it is excluded, you have to think about fires. It's an age-related syndrome. Preschool and school-age children are more affected, and there is a clear male predominance. Fires is an important differential diagnosis for refractory status epilepticus. In former times, an autoimmune etiology has been considered, but neuronal antibodies are negative in most cases, and there is no clear response to immunotherapy. At the end, we have to confess even today, 2019, that the etiology is unclear. After a certain time, after a few weeks of having fires, this severe status epilepticus, in the MRI, you can see often a global brain atrophy and hippocampal sclerosis, often on both sides. During this status epilepticus, anti-epileptic treatment is extremely difficult or not effective. And permanent epilepsy and severe mental handicaps in formerly normal children are the consequences of this severe status epilepticus, resulting in a severe epileptic encephalopathy. The early diagnosis is really important to select the optimal first-line therapy, and it only may optimize the outcome. So you can distinguish three phases. The first phase is a febrile infection, and after an interval without fever for some days, you have the acute phases with a highly recurrent focal seizures, and they are rapidly going over to a therapy refractory status epilepticus. And after this very acute phase of having status epilepticus, a chronic phase is following with a drug-resistant epilepsy and neuropsychological impairment. So this is from Andreas Bahlen in his paper in 2017, a diagram. Here you see the febrile illness, and then some days, it depends, or 1 week where nothing is going to happen, and then you have the acute epileptic phase with this super refractory status epilepticus, and then the chronic phase with neurological impairments and the drug-resistant epilepsy with seizures in clusters. So the diagnostic criteria of fires are fulminant onset of status epilepticus after fever or illness preceding these seizures, and the absence of previously neurological diseases, and the absence of encephalitis or metabolic disorders. And then you have the drug-resistant focal epilepsy and neurological impairment immediately following the acute phase. The age of onset, as I already told, is childhood with a peak of onset in school-age children. So this model is demonstrating fires has a little bit overlap with epilepsy, encephalopathy, encephalitis. There are some features, sometimes proteins in the cerebral fluid is a little bit raised, but there are no bacterials or no viral really antibodies to be detected. So in 2018, there has been a multidisciplinary group of experts who tried to standardize the definition for international collaboration and international comparison of studies, and they have created the name NORSE. It's a new onset refractory status epilepticus without a clear acute or structural abnormalities and without toxic or metabolic cause. And fires is a subcategory of NORSE, and it's applicable for all ages, but mostly in children. It requires a febrile infection starting between 2 weeks and 24 hours prior to the onset of status epilepticus. And the status epilepticus is without, or most times without, fever at onset. So how can we treat fires nowadays? And what's the role of ketogenic diet in fires? Fires, as I told you, therapy-resistant status epilepticus with a poor outcome and running into a chronic epilepsy and mental retardation. The first really very good publication came from Rima Nabut, who has been here yesterday. And she has had 9 children in her publication treated with ketogenic diet. And 7 of these 9 patients were very effective responding to ketogenic diet within 2 to 4 days. And one of these 7, there was an interruption of the ketogenic diet, and on account of that, a relapse of this really intractable status epilepticus. And fires during the acute phase has a high mortality, and he died. So it's really a very disabling status epilepticus. So the following papers are most times case reports. This from the group of Eric Kossoff. It's only one child who started on a ketogenic diet after a 3 months period of status epilepticus, 4-1, and 10 days later they were able to stop the pentobarbital infusion, and six weeks later he was extubated, and they were weaned off the ketogenic diet after 5 months with no relapse. Another group, and this is really the greatest group of children in this publication of Uri Kramer in collaboration with Andreas van Baalen. It's a multi-center study with 77 children, and they came to the conclusion that there is no evidence of efficacy for treatment modalities except intravenously immunoglobulins, ketogenic diet, and perhaps a prolonged cycle of barbiturate anesthesia. And the cognitive level of at follow-up corresponds negatively to the duration of burst suppression coma and the younger the age of onset. The conclusion is that the outcome, nevertheless, of this FIRES syndrome is really poor. There is no efficacious treatment option in the acute phase, with a possible exception of a ketogenic diet. Another study, also a very tiny population, 12 patients with FIRES. From these 12, 10 were treated with immunoglobulin treatment, and 2 of these 10 had a good response, 1 very good and sustained, and 2 were treated with ketogenic diet in the acute phase, and 1 of these 2 really showed a good and a sustained response of seizure reduction. And the conclusion is immunoglobulin and ketogenic diet may be considered a potentially efficacy treatment for FIRES. So this is really a great overview publication, again from Andreas Baalen in 2017. And the conclusion is ketogenic diet as soon as possible from the second day of the status epilepticus, so if you have excluded encephalitis and you think about fires, you should start really very soon with ketogenic diet. And perhaps that was really astonishing with cannabidiol. Cannabidiol is now in epilepsy. It's really the great hype. And which is often also effective is phenobarbital in a megadose or midazolam also in a very high dose. There are single case reports with levetiracetam or phenobarbital or bromide or all these other anti-epileptic drugs, ketamine and lidocaine as well. And yes, but not that efficacy, same efficacy as ketogenic diet. And possibly efficacy if you think about rational polytherapy at the beginning. And that's very important to have a close collaboration between neuropediatricians, immunologists, and the specialized intensive care unit team. And that's also very important that, as I already told, prolonged birth suppression coma has a negative effect of the outcome. Another review of the literature came from this international group, and it's an overview, and also here the early introduction of ketogenic diet, enteral or parenteral, is the most promising treatment. And what's important, ketogenic diet should not be used concomitant with propofol, because there has been published a death using ketogenic diet and propofol in the study group of Munich. And cannabidiol is the next really very good option perhaps nowadays in combination also with ketogenic diet. And cannabidiol has reduced the frequency and the duration of seizures during status epilepticus in fires. So what's our own experience? So we have 4 children with fires. 3 were sent to the epilepsy center Kork after the acute and already in the chronic phase. And also the 4th one, there we introduced at first after over 1 year of chronic phase and a ketogenic diet. And I will tell you about that later. So the first boy, it's all 4 cases are boys with a male predominance, as I already told you. He has had fever, infection, and then it ended up in a very therapy refractory status epilepticus. He has been intubated, tracheotomy after 4 weeks. He has brain atrophy, as I told you, hippocampal sclerosis on both sides. He has had 12 anti-epileptic drugs, and then after 2 months of acute illness, he received a 4-to-1 ketogenic diet together with topiramate, phenytoin, phenobarbital, and clobazam. And 2 weeks later, he really already was much better, more active, possible to walk with help. So after that, they tried to wean off a little bit of phenytoin because he has had side effects, hyperplasia of the gingiva, and this was really disturbing for the parents. So they reduced it a little bit, and after that he has had status epilepticus again, and he never gained to the same status as he has been before. He always has quite a lot of seizures. So going on in his history, he developed nephrocalcinosis due to ketogenic diet in combination with topiramate, and the attempt to reduce topiramate or ketogenic diet, everything was led to more seizures. So then he came to Kork. The parents were very sad. Yes, it's really, all parents are terribly depressed and really in a very difficult situation. And we try, on account of the nephrocalcinosis, we reduced the ketogenic diet after 9 months on account of nephrocalcinosis, and we couldn't see any seizure aggravation after that. We could stop topiramate and switch the therapy from phenytoin, phenobarbital to levetiracetam, valproate, and lacosamide. So the second is also a boy, nearly the same an infection, gastroenteritis, at nearly 7 years of age, and it ended also into a therapy refractory status epilepticus. He has had quite a lot of anti-epileptic drugs, also thiopental, anesthesia, methylprednisolone pulse-wise, nothing helped. And then he got a ketogenic diet, and this led to a stabilization of the seizures in combination with phenobarbital, levetiracetam, and clobazam. And after that, they changed a little bit the medication. Then he came to us after 8 months of fires in combination, a ketogenic diet 4-to-1 with lamotrigine, phenobarbital, and clobazam and lacosamide. He has quite a lot of seizures going on, myoclonic seizures, tonic seizures, and the goal was more quality of life, less anti-epileptic drugs with sedating effect, and then we changed a little bit the medication. So at the end, we also weaned a little bit down the ketogenic diet to 3-to-1 and changed to levetiracetam, valproate, and lamotrigine, and by that he really was quite more active and better going and running, and the parents were happy with that. So the third case is the last one, also a boy, the same procedure, febrile infection, 3 days later, therapy-resistant status epilepticus, quite a lot of anti-epileptic drugs, anesthesia, everything you can think about it, cyclophosphamide, prednisolone, and ketogenic diet. And he also was a little bit stabilized by ketogenic diet, but not, for sure, not seizure-free. So he was stable on phenobarbital, phenytoin, and clobazam, but still many seizures per day, myoclonic and atonic seizures, and that's with what he was coming to our center. So also here we have had the goal, quality of life, less seizures, reduction of phenobarbital because it's sedating, it's reducing muscle tonus, so we tried quite a lot. We also tried against steroids and ketogenic diet. The ketogenic diet has been effective, but not enough for the parents to be maintained. They wanted to have, yes, they wanted to have a miracle, but a miracle is not possible in fires and also not in the chronic phase. So they wanted to stop it. It was not my idea. I thought ketogenic diet was really a good thing for him, but so this was a combination of therapy. At the end, when he was going home, he was more awake, better walking, better understanding, but not less seizures. And then let's speak the last one that's really a great success, the same, a boy, 8 years. Then he has had gastroenteritis, and 5 days later he got quite a lot of seizures, different types of seizures, atonic, tonic-clonic, myoclonic seizures, atypical absences, and it was absolutely therapy resistant. And he also got recurrent status epilepticus. He was absolutely therapy resistant against everything, antibiotic therapy, acyclovir, that means antiviral therapy. He has had prednisolone, phenytoin, immunoglobulin therapy, also plasma apheresis, immunosuppressive therapy. And nevertheless, he has had status epilepticus, very cyclic course of the status epilepticus every second week. So they tried quite other anti-epileptic treatments, and in total he has had 16 anti-epileptic drugs before he came to us. He was sent from Munich to Bethel to see if epilepsy surgery is possible. For sure not. And again in Bethel he ran into a status epilepticus. So when he came to us, he already has had 1.25 years of dramatic epilepsy with recurrent status epilepticus. He has had quite a lot of seizures, myoclonias, tonic seizures, drop attacks, tonic-clonic seizures. He was not able to go to school, quite a lot of injuries. He has had hematomas on the whole body. His face was really disturbed. So this is just to give you an impression of our daily life. So quite a lot of seizures, you couldn't count them. And this is the EEG when he came in at admission. He has had during 19 minutes 55 seizures, myoclonies, just very small. This is the EEG during sleep. And this is the EEG when he was discharged from hospital. And the question is, what have we done? Quite easy. We introduced, just when he came in, a ketogenic diet with 3-to-1, and we went down to 2.5-to-1 on account of recurrent hypoglycemia. And already 3 to 5 days later, he was much better. We changed also a little bit the anticonvulsive therapy. We started again etosuximide. We started new lamotrigine and lacosamide. We stopped phenytoin and clobazam, and he was seizure-free after nearly 6 weeks being on a ketogenic diet, and he is seizure-free up till to now. We stopped lamotrigine, and after 3 years we also could stop the ketogenic diet without any relapse. We did it for a quite long time because the mother was really very anxious. After having status epilepticus for nearly 1.5 years, she didn't like to change anything because the situation was a miracle for her. And but after 3 years we did it, and he is still on etosuximide. Etosuximide is a little bit lowered down, and he is now going to a normal school with assistance and going to the 6th class. So what is the diagnosis of this case? For me, it's quite sure it has been fires. Some of the colleagues in Munich said Norse, but at the end it doesn't matter. I think it has been fires because he has had the illness just before the gastroenteritis. He has had the seizures. So let's come to the conclusion. Fires, a febrile infection-related epileptic syndrome. The etiology is still unknown, usually in school-age children with a male predominance. They develop therapy-resistant status epilepticus after a febrile illness. The prognosis is really very poor, and perhaps, only perhaps, a better outcome if ketogenic diet is used very early. As I told you, perhaps, or the best thing would be after the 2nd day of status epilepticus, and this can possibly having a good effect on the outcome. And if ketogenic diet is efficacious, it should not being stopped during the status epilepticus, as from the paper from Wiemer-Kruel. A new status epilepticus will happen surely quite often. The ketogenic diet should be treated up to 2 years after the start, and ketogenic diet can also be efficacious in the chronic phase of fires. Okay, thank you very much for your attention, and if you have any questions.